So I think we should go ahead and get started. I think we had more people registered than this, but you know how that goes, work happens. And I suspect we may have some people joining us as they wind down their mornings. So let's go ahead and get started. I know this is being recorded and will be available later on the website. And also, before I forget, if anyone would like us to share these slides after the fact, we would be happy to do that. So just put something in the chat or something if you want us to make that available, and maybe your email address. We find that people are frantically scribbling notes, and this might save you a little on the note taking if you could get the slides after. My name is Deb Kazmerzak. I have kind of a dual role today. I provide some staff support to the Iowa Association of Rural Health Clinics. IARHC have been doing that for about 2 years now. But I also work with the Iowa Chronic Care Consortium in support of community health worker programs. So that's really the reason I'm here today. But the reason I'm kicking us off is because I support IARHC. And Hannah Torsdahl, who is kind of the day-to-day point person for IARHC, is unavailable today. So I said I would do the honors. So happy to have you here. State Public Policy Group, Hannah is on here as well and is manning the Zoom meeting and the slides for us. State Public Policy Group is a company located in Des Moines that provides ongoing association management and staff support for IARHC, and has for about the last 8 months, 8 or 9 months, I guess. And so interestingly enough, they were the original staff support for IARHC back in 1995. So it's kind of a full circle thing. Here they are supporting them again. So anyway, thanks for joining today. We are very excited to talk with you about a grant opportunity that the state has received and that I participate in with my role with Iowa Chronic Care Consortium, that is bringing community health worker training to Iowans from all kinds of different organizations. So really glad to see some interest among the rural health clinic community. So I think I will just kick it over to Angie to introduce your team and get us started, and we'll just jump right in. Thanks for joining today.
Wonderful. Thanks, Deb. Hi, I'm Angie Doyle, and I work for the Iowa Health and Human Services. Abby Less with Iowa Health and Human Services will also be presenting today with me. And then we also have Rachel Black, who is not presenting, but she is our key point of contact for a lot of the community health worker projects here in Iowa. So if you have any questions following this, your our contact information, emails, is on the last slide, and you please feel free. We would enjoy and would be excited to hear from you on any questions you may have or anything we can do to assist in developing community health workers within your clinics.
And I'm Abby Less, also, as Angie said, with the Iowa Health and Human Services, and I'm going to kick off the presentation. We are excited to share with you information about Iowa's newly awarded Community Health Worker Training Program grant through HRSA. Next slide. So we're going to be going over information about the HRSA grant and the community health worker training opportunities. We're also going to describe what a community health worker is and the number of different job titles that they may have. On this slide just lists the project partners. So Iowa HHS is the lead grantee working with HRSA. We're working closely with Des Moines Area Community College, or DMAC, Iowa Chronic Care Consortium, who you will often see as ICCC, University of Iowa Institute for Public Health Practice, as well as Iowa Workforce Development. And we will go into the roles of each of these partners later on in the presentation. Next slide.
Go ahead, Hannah, thanks. So I think we just wanted to spend a few minutes at the beginning of this on what is a community health worker. I think there's growing awareness and understanding that this is really an umbrella term or kind of a category of roles and job titles. This definition that you see on the slide here is probably the most commonly used definition. It's from the American Public Health Association, and I'm not going to read it to you. But why don't you go ahead and go to the next slide, Hannah. There is a second definition on the next slide that comes from the Department of Labor. And I guess just, which is very similar to the definition on the previous slide. I think it's important to note that the Department of Labor does recognize this as a recognized occupation, and that's fairly new. Community health workers have been around a very long time, but they've never been very mainstream until maybe the last 15 years or so. There's just been kind of this explosion in use of community health workers around the country. And we have found Iowa has been a little slower to the uptake, but there's really a lot of momentum going right now. So just to not read slides to you because that's boring. The way I would define community health workers, there's two ways I think that really defines kind of who they are. And one is that they come from or have a deep understanding of the community that they serve. So this is really key and really important because they're really successful at establishing relationships, especially with underserved populations. They have similar lived experience, or they're just really embedded and active and involved in the community with the clients that they serve. Generally speaking, there are no educational requirements, although sometimes community health workers are nurses and social workers and may have advanced education. But generally speaking, it's a kind of a high school diploma or equivalent. Again, I think you'll find that it's more important to get the right fit and to find that person that can really engage with people, has the heart for the work, and the other stuff can be learned. But generally speaking, what community health workers do varies a lot, and where they work varies a lot. But if I were to summarize generally what their roles are, they would be to engage. There's a lot of reasons that people don't engage in care. Maybe lack of trust, disruption or chaos in their lives means they just don't have time to deal with, with getting their preventative care or making sure their kids are vaccinated. Or they might completely lack understanding of the healthcare system in the US. So common reasons for a lack of engagement, again, because of that lived experience or deep understanding. CHWs are really effective in engaging people. They connect. So if their jobs are to kind of assess needs and make referrals to other services beyond healthcare, often, to social services, housing, all of those kinds of things. Very often their job is to engage and connect people with services. And then to support. A lot of times community health workers can go that extra mile that the social worker, for example, doesn't have time to do, or the care coordinator doesn't have time to do, and actually help somebody fill out that Medicaid application, or maybe go to the appointment with them and help them understand the complex health instructions that they're receiving so that they can reinforce that later. So that support is really key as well. And then advocacy kind of runs throughout, both advocacy for the patient. Oftentimes the CHW will hear things from the client that they wouldn't tell anyone else. I've heard that many times. I would tell her things that I would never tell my provider about my own depression or, whatever the case may be. So going that extra mile, supporting, checking in on them to combat, that social isolation that has become such a big problem in the days of COVID. So advocacy throughout, advocacy for the client, advocacy because they're boots on the ground and they know where there are gaps in the community. So they're coming back to their organization and saying, hey, the food bank doesn't have any food. What is this community going to do? to address this problem. So kind of advocacy throughout. Okay, go ahead, Hannah. And then we mentioned that it's an umbrella term. So the National Association of Community Health Workers has identified 170 job titles that would fall under this umbrella term. So here's just a few common ones that we see. So navigator, outreach worker, family support, health coach, patient advocate, just to name a few, to give you an idea of the kinds of roles or the kinds of job titles that fall under that umbrella term. Go ahead, Hannah.
So this slide just gives a high-level overview and summary of the grant we received. So Iowa HHS was awarded the Community Health Worker Training Grant in September of 2022. The awarding agency is HRSA, and that stands for Health Resources Service Administration. This organization falls under the Federal Health and Human Service Administration. This is a 3-year grant with $1 million per year. 60% of this grant funding must go back to the community health worker. This will be through tuition waivers and stipends. The grant includes 3 different training components, which you'll see there listed on the right. We'll describe these in more detail also, but these 3 different training components are the professional skills training, which will be an online on-demand training, the community health worker registered apprentice, and public health training for community health workers. This is a statewide grant. The emphasis is to reach rural Iowa and to serve individuals at or below 250% of the federal poverty level. For the grant application, we were required to list the target population. So this is what we chose. It's not limited to this population. The next slide. So here is the roles of each of the partners that we listed earlier. So that middle top one is Iowa HHS. We administer the grant, including fiscal management, data collection, monitoring, and reporting to HRSA. We'll provide leadership, strategy development, outreach, and convening of partners. We are going to be developing that public health training for community health workers, and we'll also co-lead the Community Health Worker Alliance with ICCC. Iowa HHS has 2 primary contracts. So over to the left there, you see DMAC. They will be coordinating with Iowa's community colleges, and they'll do outreach and partnership development also, award completion certificates, and they will have a subcontract with Iowa Chronic Care Consortium. Over to the right, University of Iowa College of Public Health, they'll be hosting and maintaining the training portal through the LMS online portal, and also do that outreach and partnership development. And then down in the left corner, Iowa Chronic Care Consortium, they will be the ones offering the community health worker training and managing the community health worker registered apprenticeship, administering participant stipends, doing outreach and partnership development, assisting with data collection, and also co-leading that Community Health Worker Alliance, which is there in the middle. That Community Health Worker Alliance, this is a stakeholder advisory group representing over 20 organizations. They convene to discuss community health worker efforts across the state. And then at the bottom there, another key partnership we have is with the Iowa Workforce Development. They'll help with recruitment of enrollees, offer employment support services and job placement, and also provide support and assistance with that Community Health Worker Registered Apprenticeship Program. Next slide.
Okay, back to me. So Abby showed the slide on the background of the grant and mentioned that there are 3 components. So this is the first component, the Community Health Worker Professional Skills Training. So there are 2 ways you can get kind of comprehensive, fundamental community health worker training. And then there's the public health training component as the 3rd component. So I'm going to talk about those first 2. So we're actually in the process of converting what used to be a live virtual training into a mostly on-demand training for community health workers. And so we anticipate, because we're still in the process of this conversion, it should be about 30 hours of on-demand content. So this is a way to make it much more convenient for the learner to be able to watch it whenever they have time to watch it. However, there are 4 sessions that are required that are live virtual, excuse me, so like a Zoom meeting. And those are on some of the topics that you really need to discuss and practice. For example, coaching skills. You can't really watch a video and learn how to be a good health coach, right? So, so that merits some additional discussion and maybe some practice. So 4 live sessions, and then a few assignments and quizzes. The content's broken down into 5 courses. There's a quiz at the end of each course. You can take the quizzes as many times as you need to in order to get the outcome that you want. And I think the assignments are just 4. So 1 to go with each of those live sessions, there'll be an assignment. So overall, we estimate about a 45-hour time commitment to take the training this way. Again, almost all of it is going to be when the student has the time to do it. The only kind of time commitment through their busy day will be those live required sessions, and they'll be offered on a rolling basis. So there'll be a lot of options as to when they can take those. We just found out yesterday we will have approval for continuing education credits for this training. So if there are nurses or social workers or someone with a professional background that requires continuing ed, those will be provided. So that's a really great thing. And as we understand it, most of the training programs around the country don't have this option. So that's pretty cool. To pass this class, to earn the certificates that I'm going to talk about in a second, we ask at least 70% performance on those quizzes that you can retake, and the 4 assignments. So 70% is considered passing. And with that, you earn a competency certificate from us, from Iowa Chronic Care Consortium, and a non-credit certificate from either DMAC, which is our key partner, but actually all of the community colleges in Iowa, except 1, have also blessed this training. So if you'd rather have it from a different community college, you just request that when you enroll, and you can get your non-credit certificate from them. We are in the process of working with DMAC to make it a credit certificate, so that if the student was enrolled or later enrolled in community college in some kind of a health or human services degree program, then they could probably count this as one of their classes. So more to come on that. And then over the course of the 3 years, we plan to train 288 community health workers through this training opportunity. The tuition is $988, but with this grant, we are able to waive it. So there is no cost to the students. So this is a really great but time limited opportunity. And the reason we're so happy to get in front of groups to talk about it. Training will be available at no cost, and there are stipends available for the students as well while the funding lasts. And if the employer allows their employees to collect a stipend, we are finding that sometimes it's against policies. So they can probably get the free tuition and no stipend, or the free tuition and the stipend. And for this training, the stipend is $2,600. Go ahead to the next slide. So a little bit about what's in the training. It's very much a skills development approach. Community health workers work in such a wide range of settings that there's no way you could train to every setting, because their job is different. Even though the types of activities they do that I talked about earlier, that engaging and supporting and connecting with resources, even though they have those common threads in their role, the actual specific day-to-day and what they document and what screenings they do, and what sometimes they're trained to like do some clinical screenings like vitals and that kind of thing. Those kinds of things they learn from their employer. We help develop their skills so that they're good at it, so that they have really good, effective communication skills, so that they understand trauma and how to work with people that are trauma survivors and that kind of thing. So the target audience, again, it's that broad definition of community health workers. These do not have to be brand new employees. These can be people that have worked for you for some time, but have just never had any formal training. So think about kind of those frontline patient-facing staff that are great at what they do, and you want to retain them and kind of support them, or if there are people you can kind of advance through their career through this training opportunity, I think is great as well. As I mentioned, there are 5 courses. These are just the titles for the courses. There are 20 modules in that 30 hours of content under these 5 courses. And then there is no national standard really for community health worker training, but this C3 project competencies that you see on the slide here is an attempt to create a national standard, because since there isn't one. And so they have identified 11 core competencies that community health workers should have, and we've made sure that our training addresses all of those. Go ahead, Hannah. So that's the first way that you can access the CHW training. Does anyone want to unmute? Do you have questions, or you want to put something in the chat? I'm going to jump into the second.
This is Lindsay. What was the tuition again?
Tuition is $988, but with
Okay.
the grant that HHS got, it's nothing.
Yep, thank you.
Mm-hmm. Good to see your name on here, Lindsay.
Yes, thank you.
Okay, so the second way that we offer the community health worker training is through a U.S. Department of Labor registered apprenticeship. So this may or may not be new to you. It was new to us a few years ago at ICCC when we pursued this for community health workers. Registered apprenticeships have been around for a long time, but they're usually in, or traditionally in, like skilled trades, welders, electricians, that kind of thing, the skilled trades, but they're much newer to healthcare. And as Angie often chimes in to say, our governor is all over registered apprenticeships right now and promoting them and encouraging them. And I would say, like in IT and in healthcare, they are rapidly expanding. And it's a way to get a trained workforce for a workforce that's really in demand, and you are not finding people that are already trained in it.
And Deb, just to add to that, I mean, the HRSA grant here, there was a requirement that we offer. It was a large requirement. It was a large component of this grant that we offer this apprenticeship. And we are finding that, and a lot of the HRSA grants opportunities are coming to the department right now, this strong element of an apprenticeship. So it's not only just our Iowa governor who's really promoting it now, it's on both the state and federal level. Sorry, Deb, thanks.
No, that's okay. I think if you work in the Mercy system, I think at least here in Des Moines, I think the hospital system here has developed some healthcare registered apprenticeships. So bottom line is, I think you'll hear more and more about registered apprenticeships, and you've all had workforce shortages and been dealing with workforce issues. So I do think it's a good option. So anyway, so we have one in place. We've had it here for community health workers for a few years. This is a little different. It's a federal program, so there's more involved in it. So it requires an employer, apprentice, and Iowa Chronic Care Consortium partnership. Because there's more to it, and the training, as I'll talk about in a minute, is much more extensive. We have a lower bar to meet with our grant. We plan to train 75 people over the course of 3 years. Again, we will waive tuition, so tuition will be $0, but it's $2,500. And the stipends available is $5,000 for students going through this way. So again, this is a really great opportunity if you want to retain some valuable staff, look for career advancement opportunities for existing staff that you have. Go ahead, Hannah. So all registered apprenticeships, no matter what the occupation, have these 5 components. the employer involvement that I mentioned. The model that we have is that Iowa Chronic Care Consortium is the intermediary. And so we kind of shoulder a lot of the administrative burden of the program. More traditionally, the employer, like your RHC or your critical access hospital, would become an apprenticeship site and have to, go through all of the process to get approved and do the reporting and the documentation and that kind of thing. In our model, we're the intermediary, and so we shoulder much of that. So it doesn't mean that the employer has no responsibilities, but it means we kind of spoon feed you or hold your hand through that process. We tell you when we need something, we tell you what we need, then we take care of making sure it's submitted and all the I's are dotted and T's are crossed. So that's component one. The second component is structured paid on the job learning. So this is probably the biggest of the employer requirements. And it sounds like a far bigger deal than it is. This on the job training is things you would do with any new employee to onboard them, and kind of regular supervisory kinds of responsibilities for the most part. There is some content. I mean, you need to make sure they understand their role as a community health worker or whatever their title is. So there's some content around that as well. This is an attestation. It's not an hour by hour accounting of every training or learning experience that you provide. It's more of a general summary and attestation. So the requirement from the Department of Labor for a community health worker registered apprenticeship is 1 year, basically. It's 2,000 to 2,200 hours of paid on the job learning. So that's basically 1 year of full-time employment. For people that have been on staff that are not brand new, and very often this has been our experience, that employers are supporting people that have just never had formal training, or they're kind of revamping their role. So they're putting them through training, but they've already worked for the organization for a while. So we can grandfather or credit half of that year, 1,000 hours, which is basically 6 months. So that's kind of a way that we work with the employer and the apprentice around what topic areas you've already covered, because they've already worked for you for 2 years or whatever it is. So we can basically shorten the length of the registered apprenticeship if they've already been on staff for a while. Then the job related instruction, that's the classroom training. And so that's what Iowa Chronic Care Consortium provides. So this is different than option one, where it's mostly on demand, shorter, fewer assignments. This is much more rigorous and much richer training opportunity as well. So this is a live virtual class. You log in once a week for 23 weeks, so about 6 months for a 90-minute class. There's a textbook, which actually we provide with both options. Homework assignments, guest speakers, just a lot more involved. And it is required from the Department of Labor that it be, quite intensive instruction. So we estimate about 147 hours. That a lot depends on level of proficiency in English, learning styles, and that kind of thing. But that's our best guess. It's required from the Department of Labor that it be at least 144 hours. So much bigger time commitment on the apprentice's part, but a much greater opportunity from the stipend and then the national credential that I'll talk about in just a second. Rewards for skills gained. Okay, so this is one of the apprenticeship requirements. And what it means is you're hiring an unskilled person to learn to do the job while you're paying them to do it. So as they are gaining their skills and their competency in their job, their wage needs to be raised at certain points along the way. And this is in most cases, the employer or the apprentice's wage already exceeds our upper threshold. And if that is the case, then the employer is not required to provide these raises as they move through. It's only if they're at or around the wage that we identified in our apprenticeship. I know that sounds confusing. Sorry about that. I don't remember if I have that slide in here or not, but I could answer any questions about what those wage thresholds are if you need that. And then the fifth component of all registered apprenticeships is that if you pass, and passing for this means 80% performance versus 70% for the other, you earn a national credential. So, that gives bragging rights to the employer to say that they employ nationally credentialed community health workers. I guess it's important to say Iowa has no certification or required training or credentialing at this point, but that's kind of a growing thing among states. So at some point, Iowa may require it. I don't know. But it's also a very big deal for the student. Again, if you go back to, these are people without professional degrees and backgrounds and extensive sets of initials behind their names. This gives them that national credential. So it's really a cool opportunity. And that website on the bottom is just for Iowa's registered apprenticeship programs. So you could learn more about registered apprenticeship there. So we can go into the next slide, but let me pause again to see if there's questions. It's hard to simply describe what a registered apprenticeship is. But I think if you talk to any of the employers we've worked with in the past, they would say, Deb just walked me through it. She just told us what we needed to do and we took care of it. So it's not as big a deal as it sounds. You're muted, Angie.
Thanks. Deb. The apprenticeship can be very overwhelming. When we first looked at this application, in public health, we had never worked with apprenticeships before, and we were so thankful that we had already had this established relationship with our chronic care consortium. But through this work and since the application, once I've got to understand it, it is not nearly as intimidating as it first sounded. Really, the bulk of the work, besides on Iowa Chronic Care Consortium, because they really are doing the bulk of the work for the employer, is on the community health worker, because they are the one having to take the training and the classes. But again, as Deb said, what the community health worker gets out of this, first, if they're allowed to, a nice stipend. But in addition, they have a national credential that is portable, that they can take with them to show no matter where they go, that they have been comprehensively trained in the world of community health workers. So while there is quite a bit of work for that community health worker, the rewards I would maintain are worth it. So again, if this sounds overwhelming, it really, Deb can walk you through it, and it's not. So. And we're here to answer.
Kick it back to you guys for the next slide.
Perfect. So the third component of it was to create a public health training for community health workers. I think that the federal government recognized if we had had this largely trained members of the communities out across the country during COVID, some of the gaps and barriers that became apparent during COVID would have been mitigated with this trained frontline public health staff. So one of the components, again, was to, once we had these community health workers trained, to train them in really our first specialty. We see this building eventually in other specialties, but the first one will be in public health. So training community health workers in the area of public health. We are currently developing it. We actually just got to go ahead this morning on the topics and subjects that will be under this training. And one obviously is the public health competencies. That's a huge one. It will be 10 to 12 hours. Actually, it looks like it will be more like 12 hours now. Once that is done, people will be getting a certificate of completion of this public health training that they can stack on top of the other certificates they receive on the foundation training. There, we said we would reach 120 community health workers and other support workers. And we hope that even after this grant is over, that this will be a quality training that we can use with a wide range of people on training on the basics of public health. And again, the tuition is waived on this. Hannah, next slide, please. So the availability of all these different options. The first one, the professional skills training, will be Q2. We are hoping in May of 2023. The registered apprenticeship, we are enrolling people right now. So again, if you are interested, we are hoping to start our first class in 2023. This class is live. So there will be, days where it will start and days that will end versus the professional skills that you can jump on at any time. So we would love to see you this year, but if you are not available this year, we will have 2 subsequent years to be opening up those core cohorts for the apprenticeships. And in the public health training, yes.
Let me just add that there's a little bit of upfront work between the employer and ICCC to get this up and running. So we are starting, it's not tentative anymore. We are starting a cohort in the middle of April. And so if this is of interest, I would love to hear from you really soon so that we could just start that process. It's just like it was when I go through those slides. It's just a little bit of a learning curve usually for the employers. And so there's questions and some paperwork that we have to do up front. So
Thanks, Deb. And in the public health training, we probably hope to have it done, I'm saying late summer, early fall. Next slide, Hannah, thank you. Here's our eligibility. And these first ones were dictated to us by our federal grant. A person must be 18 and older. They must have a high school diploma or equivalency. They must be a U.S. citizen or foreign national having possession of a visa permit residency in the United States. We would never want to encourage anyone, but just to let our stakeholders know this is self-declared. The information here is self-declared. So if they are in the apprenticeship program, they must have full-time employment status. And I believe full-time is considered 32 weeks, Deb?
32 hours per week.
Yep. I'm sorry. I meant 32 hours. Working, and that's just for the apprenticeship. On the basic skills training one, they do not need to be employed at that time as a community health worker. And then for both of them, working in a community health worker role or other frontline role or a desire to enter the workforce. We're really hoping to also reach out to people who are considering, roles in, nursing or social work or human services or as a community health worker. This is a great introduction into all those different worlds. And so we would invite people who have never even had a background in this area, but a desire to maybe learn about it. There will be an application process for each component. And again, for the stipend, the employer must accept, let the person accept the stipend. We as a state employees, we would not be able to allow to get stipend. As we do outreach, it sounds like it's mostly public employers that could be an issue. So anyway, I think I've got that covered. But the tuition is regardless. So here again, we're going over how much these professional skills training usually is, the registered apprenticeship. This includes the stipend. I think the most important thing to really emphasize here is that this is an opportunity. We have this opportunity for the next 3 years. After 3 years, the stipends may not be available and there'll be a tuition cost. So if this is something you are considering implementing in your clinics, this is the time to do it. This is a great opportunity. Okay, Hannah, next slide. And again, there I'm on top, Angie Doyle Scar, Abby Les, Rachel Black, and then Tammy as our representative from DMAC. And then I think most of you guys know Deb. And there's our contact information.
So just a note about the website. There are 2 presentations on there, like recorded presentations, much like you just heard. But one is more specific about the CHW professional skills, and the other one is specific to the registered apprenticeship. So, and there's also FAQs on the website. The applications are not live yet, But I would encourage you, or if you're like wanting to pass this information on to someone else, to check out those recordings on the website, or just the website in general, because it should have some helpful information. I think that's the end of it, except for maybe questions. Are there questions we can answer? Had a brief conversation with the IARHC board about this, about whether or not they thought there would be interest among the RHCs in this opportunity. And it feels like my sense is that this is kind of a newer workforce in the rural health clinic world. But I would encourage you to think about the staff you already have that have those kinds of roles. Half the challenge, I think, is getting people to understand what that umbrella definition really entails. And I'm guessing there are staff in roles that probably would fall under that umbrella definition. Any questions we can answer for anyone? Well, again, give it some thought. Feel free to share this information. I think, Hannah, the recording will be on the website soon, I think, right? Hannah's nodding, yeah. So we'll make that available. You've saw my email on the slide. If you're interested in the registered apprenticeship, we just would want to start that conversation really soon so we can get going in time for the April class. And just thanks for your interest and your time today.
Thank you.
Thanks for joining. Take care, everyone.